Hey, good morning, everybody. This is Brittany with the Seniors Blue Book, and I wanted to say a big welcome this morning to Sarah Keenan. She is the CCO of Bluestone Physician Services. Good morning and welcome to Seniors Blue Book Live.
Good morning, Brittany, and everyone
today?
else. I am very good. How are you?
Doing awesome. Thank you so much for being here with us this morning. I wanted to ask you a little bit about yourself as well. We've learned about Bluestone through a few of our Seniors Blue Book Lives, but talk a little bit about your role with Bluestone and maybe kind of touch on, for those that are new and this is their first Bluestone experience, just a little bit on who Bluestone is.
Sure, thank you. I will start with who Bluestone is, and then I'll get into a little bit more about me in particular. So Bluestone, we are a primary care clinic, and 100% of what we do is to serve folks who live in residential care settings, primarily assisted living settings. So while we are a traditional primary care clinic, we sure don't look like one. We have no brick and mortar clinics. All of our care is delivered via mobile services and lately via telehealth services due to COVID. But we've been around for about 15 years. We were started in Minnesota, so a little colder than where y'all are. So that's actually where I am right now. So I'm actually watching snow out my window right now. Yep. So looking forward to coming down and visiting. So again, we've been around for about 15 years. We were started by a physician, Dr. Todd Stivlin, who still is our owner today, who was really frustrated with his ability to care for folks in kind of traditional healthcare and 15-minute appointment slots, and also recognized the value and just the necessity of coordinating his services with those services so valuable provided by the assisted living and other residential care staff. So he started Bluestone, and I'll fast forward. We're now in Minnesota, Wisconsin, and Florida. We serve almost 17,000 folks who live in assisted livings through a very team-based model, and that's going to get us into some other stuff we'll talk about today. But so I'm the Chief Clinical Officer. I'm a nurse. I've been with Bluestone for 10 years and really have the honor of working with kind of the clinical side of what we do in terms of our nursing staff and our care management staff and all of our quality programs, things like that.
That's awesome. Thank you so much. I can say that I've never sat in your shoes and just sat where I live and watched some, snowfall on the ground. Maybe I can see the humidity. Maybe that could be snow or
I'm tempted to turn the camera around and show you, but
yeah, I want to say today that it was a little bit cooler, meaning that it was probably about 85 with a feel like of about 90. So I thank you so much for introducing yourself, and that's amazing that you've been with them for 10 years, and that I actually did not know that you guys have been around for 15 years. So that's amazing that this journey began that long ago with you guys, and I've worked with you previously too in an assisted living community, and you guys do such a fantastic job, and it's such a needed service for residents, especially right now, with everything that's going on. So thank you for that. And I know we want to talk about a couple of new programs. And so one of those is the post-acute care management side of things. So let's talk about that and kind of why that was started with Bluestone.
Absolutely. So healthcare in general, and I won't go too far in the weeds on that, is really moving from a fee-for-service model, really that traditional model, to one that we call value-based. And that there's a lot of words we can toss around, but really what that means is healthcare is moving to getting the right services to the right people at the right time, and really paying attention to the outcomes, to how well patients are being taken care of, as opposed to just how many things are being done. It's a wonderful move that's happening. And in response to that, Bluestone is moving into a lot of value-based type care models for an accountable care organization and ACO. And many of the initiatives that's driving are the development of some new roles, which are honestly filling some gaps. We'll be very transparent, is that in delivering primary care in assisted living settings, it's fantastic. When we're there, we're able to work so closely with the assisted living staff. but we were not able to really manage in a very complete way. Certainly there was a lot of good work that was done when folks would leave the assisted living and go into the hospital and go into the nursing home and hopefully come back to the assisted living. There was a lot of work that was done to get relationships done with hospitals and things like that. But really that role of a care manager, so a nurse or a social worker, who that's their role, that's what they do. As soon as folks need to leave the community and go elsewhere for a higher level of care, those care managers spring into action, and they're calling the hospital and when folks get to the nursing home, and really bringing information on what patients' needs were and what their goals of care, really communicating if there is a need, which there often is for who's ever taking care of the patient in the acute care side, to talk to the Bluestone primary care provider. That care manager will make that connection. So really the goal is, particularly for folks who might have a diagnosis of dementia or have other difficulties in expressing their goals of care, really it's to act as that patient's advocate throughout that transition. And as well as then working with the assisted living staff when the patient might be in a nursing home or even coming back from a hospital, and making sure that there really is a good pathway for that patient to come back and that all of their needs are coordinated when they arrive.
This is such an amazing addition to what you already do. And it's like you said, some of those words were communication and kind of between the gaps. And I know from being in a community and you're wearing so many hats and you're trying to care manage, but you're taking care of different needs for that resident. That's such an amazing and necessary role. So I'm so happy to hear that that's a part of what you're doing. One question I have is if there's already a patient with you guys, is this something that's now being added on for them, or how does it work? Is it just something that's naturally happening for every single one of your patients?
The intent is that it will be. So we're building this program. So we have several care managers already working, particularly in Sarasota. Tracy Caraballo is already out there working and making connections. And so we will build that staff over time. But yes, the intention is that we are building this team-based care. So, picture that patient centered, that patient in the middle. And currently we've got the primary care staff and the assisted living staff, home care, hospice. We're just adding in a few more folks around that circle to work with every Bluestone patient. That's
awesome. So another new program that we wanted to talk about today is your behavioral health. That's obviously another part of healthcare that sometimes it kind of falls between the cracks. And I think that there's been a big emphasis this year, especially on all of our mental health, but especially in the aging population. So let's talk a little bit about that behavioral health program.
Absolutely. This is one that we are so passionate about. Behavioral health, mental health services is absolutely, critical to address, as you're saying, for seniors. It always has been, and then under the COVID, it has become even more pronounced. So behavioral health for Bluestone falls into basically two services. One is we are developing psychiatric providers in the Florida area. So and that will again be a growth opportunity as we work with folks and grow programs. So having the ability to have psych nurse practitioners who are really filling that need of managing medications and working with folks that who might be a little bit more acutely ill or have higher needs with behavioral health and mental health needs. So they'll certainly watch for that as we grow that program. Our behavioral health care management program are social workers and staff that have rich backgrounds in psychology and gerontology, who are working to really meet that more non-pharmacological needs around managing and working with folks on behavioral health issues. So examples would be working with folks who might be residing in a memory care and are having challenges with behaviors. Our behavioral health care managers have great experience and really going into communities and talking to staff and family and really figuring out, gosh, you know what, if if these behaviors and challenges and anxiety are really, really, pronounced around dinner time, are there things that we can do, and some care management and care planning activities around, changing the environment, just kind of being an extra pair of eyes and ears, and maybe to your point, where the staff of the communities are so amazing, but they're trying to do so much, just someone who can go, what if we tried this? So that's those care managers. So, and during COVID, we're getting in there as much as possible according to what's safe per the state and per communities. But even if we can't, then we're working telephonically to get those care plans in. So one part with our behavioral health care managers that we're really rolling out right now is some programming to specifically address the depression and anxiety that is coming from isolation. So this developed actually pretty organically from some of our care managers who, when we talked to them about what they were doing when they couldn't be present physically in some of our communities, we heard stories that they maybe were making activity boxes based on folks, things they loved, and mailing them to the resident of the assisted living. Then telephonically, they would go through the box and talk to them, and really making connections and trying to find ways that folks, even when they can't see their loved ones, have someone to talk to. So the behavioral health care management program is actually a program that is funded through Medicare. So that is, so folks need to have Medicare to access that, which most do, but it's also it's a really optimistic thing and a new benefit for Medicare, because Medicare has not traditionally put a lot of resources into behavioral health. So it's a good sign from our whole healthcare system that there's more attention paid to that kind of whole person care.
It's absolutely amazing. I love the idea that they were sending these, doing these like care packages, or I'm trying to think of like the proper term, but it's such like a personal care package. And I know how much even just like a card can mean to somebody, that somebody else would take the time to think of them because they may not have family here or here or near. So that's amazing. And I do want to mention too, there's a lot of communities that watch our live videos and meet other professionals and kind of learn more about services. You guys, are you at this time, and I maybe can pull Ashley into this at some point, but are you guys looking to grow as far as in this market? We kind of cover the Charlotte, Sarasota, and Manatee counties. So is there opportunity for professionals to reach out to you to have Bluestone be the new mobile physician group at their building?
Oh, absolutely. We have several new providers joining our team in that area that we're very, very excited for them to join us. And definitely that's our favorite way to be able to reach additional folks is for folks to just kind of hear our story, hear what we're doing. We tend not to be we don't put up billboards and things like that. So it really is, talking to other folks who are working to serve the same folks that we're working to serve. That's our favorite way to expand growth.
Absolutely. Well, I want to thank you so much for your time today and just sharing about these new programs. You guys really you're growing. It's important, obviously, for any business or anything to kind of look at the new ways to grow. And it sounds like through everything that's happened, you guys have really expanded your services. And it's amazing. So thank you so much for your time this morning. And if there's any final words of wisdom, whether it's about snow or Minnesota or whatever it may be, do you have any last words to share with our audience?
Fantastic Minnesota accent there for a second. So no, I would just wish everyone just, be safe. We're all going to get through this together. And don't hesitate to reach out to Bluestone for anything that we can help with.
Awesome. All right. Well, thanks everybody for tuning in. And again, this has been Sarah Keenan with Bluestone Physician Services, and I'm Brittany with Seniors Blue Book. And if you'd like more information, I'll put everything in the post to reach out to Bluestone, and we hope you have a great day. Thanks for watching.